Do you ever feel dizzy or lightheaded and wonder if your blood pressure might be the culprit? Or perhaps you've been advised by your doctor to keep an eye on your blood pressure at home, but you're not quite sure how to do it properly. You're not alone. Many people struggle with understanding how to accurately measure their blood pressure at home, leading to confusion about whether they have low blood pressure, hypotension, high blood pressure, hypertension, or something in between. But don't worry, by the end of this video, you'll have the knowledge and confidence to read your blood pressure at home like a pro. Before we dive into the step-by-step process of measuring your blood pressure at home, let's quickly go over what blood pressure is and why it's so important. Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps blood. It's measured in millimeters of mercury, mmHg, and recorded with two numbers: systolic pressure, the top number, and diastolic pressure, the bottom number. Systolic pressure represents the pressure in your arteries when your heart beats, while diastolic pressure measures the pressure when your heart is resting between beats. For example, if your blood pressure reading is 120/80ths of a millimeter Hg, 120 is the systolic pressure, and 80 is the diastolic pressure. Understanding these numbers is crucial because they give you insight into your cardiovascular health. High blood pressure, or hypertension, can lead to serious health problems like heart attacks and strokes if left unmanaged. On the other hand, low blood pressure, or hypotension, can cause dizziness, fainting, and other complications. Why monitoring blood pressure at home matters. Monitoring your blood pressure at home is vital for several reasons. First, it provides a more accurate picture of your blood pressure over time, especially if you suffer from white coat syndrome, where your blood pressure spikes in a clinical setting due to anxiety. Second, it helps you and your healthcare provider track how well your blood pressure management plan is working. Finally, it empowers you to take control of your health by making informed decisions about your lifestyle and treatment. Choosing the right blood pressure monitor. The first step in accurately measuring your blood pressure at home is choosing the right blood pressure monitor. There are many types of monitors available, but the two most common are manual monitors. These require you to inflate the cuff manually and listen for your pulse using a stethoscope. While they can be accurate, they require practice and skill to use correctly. Digital monitors. These are the most popular for home use because they are easy to operate and display the results on a digital screen. Most digital monitors are automatic, meaning they inflate the cuff and take the reading for you. When choosing a monitor, make sure it has been validated for accuracy and is the right size for your arm. A cuff that's too small or too large can give inaccurate readings. How to prepare for a blood pressure reading. Before taking your blood pressure, there are a few steps you should follow to ensure an accurate reading. Rest for 5 minutes. Sit quietly and avoid any activity that could raise your heart rate, such as exercising or drinking caffeine. Use the bathroom. A full bladder can increase your blood pressure temporarily. Sit properly. Sit with your back supported, feet flat on the floor, and legs uncrossed. Rest your arm on a flat surface at heart level. Avoid talking. During the measurement, stay still and quiet, as talking or moving can affect the accuracy of the reading. Step-by-step guide to measuring blood pressure at home. Now that you're prepared, let's go through the steps to measure your blood pressure at home. Wrap the cuff around your upper arm. Place the cuff on your upper arm, about an inch above the bend of your elbow. The cuff should be snug but not too tight. You should be able to fit 2 fingers under it. Position your arm. Rest your arm on a table or armrest so that it's at the same level as your heart. This position helps ensure an accurate reading. Turn on the monitor. If you're using a digital monitor, simply press the start button. The cuff will inflate automatically. If you're using a manual monitor, you'll need to pump the bulb to inflate the cuff. Wait for the reading. As the cuff inflates, you might feel some pressure on your arm. This is normal. The monitor will then slowly deflate the cuff while measuring your blood pressure. Record the results. Once the monitor has finished, it will display your systolic and diastolic pressure on the screen. Write down these numbers along with the date and time of the measurement. Take multiple readings. To ensure accuracy, take 2 or 3 readings, each about 1 minute apart, and record the average of these readings. Understanding your blood pressure results. Now that you have your blood pressure readings, it's important to know what they mean. Normal blood pressure. A reading of less than 120/80ths of a millimeter Hg is considered normal. This means your heart and arteries are functioning well, and your risk of heart disease is lower. Elevated blood pressure. If your systolic pressure is between 120,000 129 mm Hg and your diastolic pressure is less than 80 mm Hg, you have elevated blood pressure. This isn't yet hypertension, but it's a sign that you need to start making heart-healthy lifestyle changes. High blood pressure, hypertension. A reading of 130/80ths of a millimeter Hg or higher indicates hypertension. Depending on how high your readings are, your doctor may diagnose you with stage 1 or stage 2 hypertension, which will require treatment and lifestyle changes. Low blood pressure, hypotension. If your reading is consistently lower than 90/60ths of a millimeter Hg, you may have low blood pressure. This can cause symptoms like dizziness, fainting, and fatigue. If you experience these symptoms, it's important to talk to your doctor. What to do if your readings are abnormal? If you consistently get readings that are higher or lower than normal, don't panic. Instead, follow these steps. Check your technique. Ensure that you're following the proper steps for measuring your blood pressure. Even small mistakes can lead to inaccurate readings. Take multiple readings. Blood pressure can fluctuate throughout the day, so take readings at different times to get an accurate picture. Consult your doctor. If your readings are consistently abnormal, contact your healthcare provider. They may adjust your treatment plan or suggest lifestyle changes. Tips for maintaining healthy blood pressure. In addition to monitoring your blood pressure, here are some tips to help maintain healthy blood pressure levels. Eat a balanced diet. Focus on fruits, vegetables, whole grains, lean proteins, and low-fat dairy. Reduce your intake of sodium, saturated fats, and added sugars. Exercise regularly. Aim for at least 30 minutes of moderate exercise most days of the week. Activities like walking, swimming, or cycling can help lower blood pressure. Limit alcohol and caffeine. Both can raise blood pressure, so consume them in moderation. Manage stress. Chronic stress can contribute to high blood pressure. Practice relaxation techniques like deep breathing, meditation, or yoga. Quit smoking. Smoking damages blood vessels and raises blood pressure. Quitting is one of the best things you can do for your heart. Reading your blood pressure at home doesn't have to be complicated. By following these simple steps, you can get accurate readings and take control of your heart health. Remember, your blood pressure is a key indicator of your overall health, so make monitoring it a regular part of your routine. And if you ever have concerns about your readings, don't hesitate to reach out to your healthcare provider for guidance. With the right knowledge and tools, you can keep your blood pressure in check and live a healthier life.